So the BREAKWATER study is a randomized phase 3 study that was looking at the FOLFOX chemotherapy backbone. After completion of the phase 3 study, there was what we call cohort 3, which is a cohort of FOLFIRI backbone combined with Encorafenib, Cetuximab versus a FOLFIRI-based control arm. So the study was designed to look as a primary response rate of primary outcome of response rate, but also key secondary of progression-free survival with exploratory analysis of overall survival. These were in previously untreated BRAF V600E mutated metastatic colorectal cancer patients that had not previously been treated with any therapies. Now, the response rate had been reported out previously, demonstrated a very nice improvement in response rate with the combination of Encorafenib and Cetuximab. But the data here was looking at the progression-free survival. What we saw with the data was that the progression-free survival was in the control arm was 8.3 months, and it improved up to 15.2 months with the experimental arm. So a really substantial increase in that progression-free survival. And this was at least numerically in a very similar range, if not numerically better than what we saw with the FOLFOX, Encorafenib, Cetuximab, but demonstrated the progression-free survival's improvements with this regimen. Now, overall survival is a secondary endpoint, and we have a early readout of about 18-month overall survival. And what we saw was that the median overall survival is not yet reached in the experimental arm, but it was 20 months in the control arm. The hazard ratio so far is right around 0.55 at this early look. So while this is not a powered endpoint, at least shows trends that are very similar to the doubling in median overall survival that we saw with the FOLFOX backbone.